Think fast. Who's at a greater risk for tearing their ACL, left or right? Let's rewind it. Watch it one more time. Left or right? Who did you pick and why? Now I want you to pick heads or tails. Why did you pick your choice? Surprisingly enough, your chance of picking either correctly is exactly the same. All right, so let's talk about a recent paper by Mortvid et al. 2019 titled I Spy with My Little Eye, a Knee About to Go Pop. Can coaches and sports medicine professionals predict who is at greater risk for ACL rupture? And to help talk us through this topic today, I have my beautiful wife, Nicole Sertica, who specializes in ACL rehab. So Nicole, can you talk us through what the study was looking at?
Yes, they took videos of 100 different female football or soccer players and handball players and had people through online, whether it's social media or email, look at that video and assess or try to predict who is at risk of tearing their ACL.
And so they had coaches, physical therapists, researchers, physicians across different fields look at this information. And they kind of found, right, that they were no better than if they were just to flip a coin and say heads or tails.
Right, and even further is people who work in sports medicine or who have done this assessment before were no better at predicting it than people who don't work with athletes or who have never used this assessment before.
And so despite that finding, when they were going through this survey, how confident were they in their ability to predict who was going to tear their ACL?
Yeah, so on average, the assessors rated their confidence in their predictive ability to be a 6 out of 10, 10 being really high confidence. So it shows us that we think we know who, we think that we can predict who's going to go on to have an ACL injury, but we can't.
So this study showed us that the drop vertical jump, at least in this population of elite handballers and footballers, doesn't really necessarily prospectively tell us who was going to go on and tear their ACL. So is this a test that we should get rid of completely, or what does the other research tell us?
Yeah, so what this test might do is, so we know that when somebody goes and tears their ACL, a lot of the times, most of the times, they're in a more knee extended position, so the first 20 degrees of knee flexion. They go into that knee abduction moment or that knee valgus where you see their knee caving in. And it's when they land, pivot, change direction, decelerate off of that leg. So when we look at a vertical drop jump test, we can see if somebody's legs go into that valgus position. And actually, there is a study done by Nilstead et al. That Roald Barr is also on that article that showed that physical therapists are able to see knee abduction or knee valgus moments or that those knees caving in during a vertical drop jump test. So this assessment may just serve as a conduit for we see that they go into that knee valgus, but that alone doesn't necessarily mean they are or are not going to have an ACL injury.
And with this study in particular that we're discussing, there were a few things that most of the coaches and sports medicine professionals looked at to determine whether they thought someone was going to tear their ACL. So what were those things that they were looking at?
Yeah, so actually like 99% of the assessors were all looking at things like inward and outward knee motion, knee position when landing. So they're all looking at the same thing to decide, to make their decision as to whether or not this person is going to tear their ACL. But maybe those cues or those things we're looking at don't tell us the whole story about ACL injury.
And this is something that we see a lot on social media because we do see with non-contact injuries, as Nicole was talking about, is that, we see this kind of hip internal rotation, this knee valgus, and this associated ACL ruptures, right? So then when we see people move, we say, oh, they have this knee valgus, they have this hip internal rotation, they must be at a greater risk for injury. But once again, with this test and with this paper, they're showing that perhaps that's not the case. At the very least, there's some limitations with this test because it's not unilateral, it's not very high load, it's not reactive, and we've also seen in the literature that it's pretty hard with one single movement, one single test to predict who was going to go on to tear their ACL, right?
Yeah, and there's even been studies like Hewitt et al. Found that increased knee abduction moments and increased ground reaction forces during a vertical drop jump test are predictive or are associated, not predictive, they're associated with who will go on to have an ACL injury. But then a study by Kreshog et al. Showed that neither knee abduction moment nor ground reaction forces were associated with who's going to have an ACL injury. So for as many studies as there are that show us that there are parts of this test that can tell us who's at risk, there are other studies that show that we can't really see that. So again, for those reasons, maybe we do see on a vertical drop jump test that somebody's knees cave in into that valgus position. But because this movement task is very different from something they would encounter on the field, and this cohort looking at footballers and handball players, it's not very common that you're going to be landing on both feet and jumping straight up again. That's not really a sport-specific movement. So it's not really giving us the whole story or the whole picture of who will have an ACL injury.
Right. And you think we could extrapolate this to some other movements? So same thing, we see people squat, maybe they have a little bit of knee valgus, or they do a jump over a hurdle and they have a little bit of knee valgus, and you might see in the comments, ooh, that looks bad, ooh, they're going to blow out an ACL. Is that kind of the same thing, that we're probably not going to be very predictive of who's going to tear their ACL, especially on something as, low of a load on the ACL perhaps as a squat or a jump like that too?
Right, and then what I think also the danger in that is if we're doing this for like a screening assessment to see, okay, who's at risk because I want to implement some kind of intervention with that at-risk group, well, there's people who will do this perfectly and still tear their ACL. Okay. And there's people who will look like garbage and not tear their ACL. So it's hard to say, like, oh, because they look like this in this test, that they are or are not going to tear it.
And the important thing to note here is this is individuals who have not had a previous ACL rupture, right? So this is looking at people who go on to have their first ACL rupture. So now with these types of movements, right? So this test or other jumping, landing type exercises, are they useful or are they not useful?
Depends on what the use is. So if we're trying to use them, like I said, as a screening assessment to group people into at-risk or not at risk and then give the at-risk group an intervention, I would say it's not useful because we're going to miss people in the not at-risk group who will tear. And then we're applying an intervention to people who aren't going to. So I say it's better to give the intervention to the entire team or whoever you're screening. And in that way you capture everyone. And you're not going to have any harm by doing the intervention. You can only benefit from it. So if you're trying to do it for a purpose of seeing who's at risk, I would say it's probably not useful. But if you want to do it as an injury risk reduction strategy, certainly neuromuscular control is something that's been looked at and has been shown to reduce the risk of injury, like ACL injury. So not that you have to only do the vertical drop jump task, but you can apply, you can do some other plyometric, other neuromuscular control. But the important thing to understand there is that even if you implement an intervention like the vertical drop jump test or other plyometric strategies, that you may decrease their risk of injury, but not necessarily change their mechanics that are associated with ACL injury.
And there's some good research from Amy Arundel, right, in her PhD. Mm-hmm. And we actually did a podcast with her, so you can go back and listen to that where she talks about that. So what Nicole is saying is that you can implement some of these neuromuscular control type exercises and see a reduction in injuries at the knee, right, in people who you think are going to tear it or not. It doesn't matter, we're applying it globally. So that's really cool, is that we apply these exercises, we can see a reduction in injury without necessarily seeing a change in the mechanics. And there are some free programs out there, right, that you can go and look it up right now and start implementing this today.
Yeah, like the FIFA 11 Plus has been shown to reduce the risk not only of ACL injuries, but of lower extremity injuries in general in soccer players. It's a predominantly soccer-based dynamic warm-up. So it's been shown to reduce the risk of injury Again, it may not change your mechanics at all, but that's okay because your injury risk is still down.
And we can put that link in the description, right? So you click it, you watch, you go through it. It's free. And the reason a lot of people don't use this is maybe they don't know about it. Time, maybe they're not bought into the process, right? You have a 60-minute practice, so why are you going to do it and cut into that time? So maybe people show up early and do this 20-minute dynamic warm-up on their own, but rather than reaching for these other strategies or supplements or whatever else to try to reduce your risk of injury, there's these free programs out there that you can do in a fairly short amount of time that can actually help you reduce the risk of injury.
Yeah, and once you learn how to do it, initially, as with anything else, as the first couple times you do the FIFA 11 Plus, it's going to take a little bit longer just because you're unfamiliar with it. But once you get to know it, you can run through it in 10 minutes. And there's actually a study that shows that if you take the strengthening component out of the warm-up part and do it at the end of practice, that you still have the same reduction in injury. So it's still just as effective. So before practice, you can spend 10 minutes just doing the dynamic warm-up portion. And then at the end, do the strengthening component, and you're still going to have that reduction in injury risk.
So, if you're someone who plays a field sport, plays a sport on the court, and you're a cutting sport, a decelerating sport, and you're worried about tearing an ACL, rather than maybe over-focusing on how do my knees look, right? It's making sure that you have a well-rounded strengthening program. You're doing a nice dynamic warm-up. But how about someone who's already torn their ACL and they're worried about tearing that same reconstructed ACL, or they're worried about tearing their contralateral side? What is some information that they need to know? What are some, are there any risk factors there for having another ACL tear?
Yeah, so we actually know a little bit more about helping to reduce the risk of a secondary injury than we do about the primary injury. Because there's a lot of factors that can go into a first-time ACL injury, a lot that we're still unsure of. But as far as the second ACL injury, it seems like once you've had an ACL injury, you tend to unload that knee, that surgical knee a little bit, and you either shift onto your other side or you make some changes in how you move in that same leg. So maybe you use your hip and ankle more and your knee less. So when you go to do things on the field or court, like cutting, landing, pivoting, decelerating, then you're shifting the amount that you're using your knee, you're shifting that away from your knee and doing it in your hip and ankle. So what that looks like on the field is your knee is going to be more rigid and extended, and maybe you have more hip flexion, more ankle plantar flexion. And not only is that really not an efficient movement pattern from a performance perspective, you're not going to be as fast or as powerful that way, but it also is how we tear our ACLs, by being in those first 20 degrees of knee bend. So being either really straight on your knee or just 20 degrees of bend in your knee. That's when we're going to see ACL injuries occur. And then trying to pivot or change direction off of that, that's when those secondary ACL injuries happen.
And people hear this kind of compensation of offloading the knee, loading the ankle and the hip, and think of this obvious rotation in the pelvis or shift in their weight. And that's not necessarily the case. There's this good research by Susan Sigward that shows that maybe 3 months, you can kind of see these inter-limb differences. Maybe there is a shift, but then you get closer to 5 months and they're having these intra-limb compensations that aren't really visible to the naked eye, right? So you could be doing your squats or your Bulgarian split squats or whatever your, exercises are for strengthening the lower extremity, and you might not be able to visualize those changes. So what we need to do is really focus on strengthening the quad, right?
Mm-hmm. Yeah, I would say if you've torn your ACL before and you're worried about another injury, make sure that you're really getting that quad nice and strong, definitely at least 90% as strong as the other side. But if it's your dominant leg, I would say even stronger. And of course, we want both quads to be really strong. I would say work on your landings, your changing direction, and make sure that you're doing things that are reactive in nature on a single leg. And also a big thing is don't go back too soon. Wait until 9 to 12 months to get back to your sport full time. So those are the kind of things that I would focus on if you've already torn your ACL. Have a nice, good, holistic strengthening and conditioning program. Get your quad strong. Wait at least 9 to 12 months.
And when we say get the quad strong, that usually means including leg extensions, right? So there's a lot of misinformation, whether it relates to the patellofemoral joint and causing some extra stress there, or the ACL because of the shear potentially that a leg extension places on it. And I'm not saying to necessarily ignore the recommendations of your surgeon or your physical therapist, but there's a lot of good research out there that shows using that leg extension often and early can be very helpful. It's not going to put you at an increased risk for laxity or tear of the ACL. And this is a conversation that you can have with your surgeon or with your physical therapist, especially if you are worried about these certain ranges of motion of the leg extension. It's really easy to implement isometrics where your knee is bent to 90, 80, 70, 60 degrees, where there's not really any shear strain on the ACL there, but you're still loading the quad safely, right? And so, like I said, that's a conversation to have with your surgeon, to have with your physical therapist, and it's probably going to be a topic for a future video, but there's a lot of good research that shows you got to strengthen that quad. The leg extensions are very, very helpful, and from what we know right now, there doesn't seem to be any harm in actually using them.
Yeah, I would say I definitely use leg extensions with patients that I'm working with after an ACL reconstruction because it's so, like you said, at 3 to 5 months we see that shift into intra-limb compensations that we can't see. So still do squats, Bulgarian split squats, deadlifts, things like that. But in order to really isolate the quads in a way that they can't compensate with other movement strategies, I don't think there's much better than leg extensions.
Personally, I usually use isometrics to start early on. I'm not going to get into specific time frames right now. It is going to be individualized. But isometrics, right, then you can go into that shortened range of motion where maybe you're not going to that terminal knee extension where the leg is all the way straight and then working through that full range of motion. Now, if you're somebody who's, a year out and you just feel like your knee isn't the same after your, ACL reconstruction, there's no reason you probably can't go through that full range of motion, right? So that's something to think about. Now, if you want to learn more about the study, it is a good paper. Put it in the description below, so you can click that link. If you want to know more about Nicole, you can head over to her YouTube, her website, Nicole Sortica Physio. So she puts out a lot of good information. She has a blog updated weekly every Monday. She puts out a podcast every Tuesday. She focuses a lot on soccer rehabilitation and performance. So if you're into soccer in any capacity, make sure to check out her information. And this paper was reviewed in Physio Network, which is a great research review which takes, recent relevant research, breaks it down really nicely. And so if you want to learn more about Physio Network, learn about other studies, that link will also be in the description. And then obviously to continue following us at E3 Rehab, make sure you smash that like button. Make sure you subscribe if you haven't already. And then, you can follow us on all of our different social media platforms. So thank you so much for watching. Peace.
Bye.